I often get asked by dental hygienists, what kind of instruments should I use? What should be in my kit? And what I find is that most times than not, most of the kits are exactly the same. So why do we have to have so many instruments in every kit when maybe we're only going to use a certain amount, maybe 3 or 4 in one treatment? So why not create a unique tray setup for each client? So what I want to talk to you today about is a typical day in the dental hygiene practice, and what does that look like with my instrument tray setup? So in a typical day, what I would recommend is that perhaps you would have, say, 5 of these cassettes with these instruments. This set here can take care of most of your recare appointments. So we have the mirror, the 1112, it's the Flex Explorer, which is my absolute favorite Explorer. The tactile sensitivity is amazing. It's a very nice thin wire, and I promise you, you will love this instrument. So the mirror, the Explorer, and a probe, okay? Now, what we have next is the Sharp Jack, which I'm going to explain about in a little bit. But the Sharp Jack is a universal scaler. And then we have the Syntet, which is like a Gracie 1112 and a Gracie 1314, all in the same instrument. So it is a dual Gracie, so you can do the posterior and the anterior with the curette, like with this one, throughout the entire mouth, and this one as a sickle. So this kit here, if you had 5 of these sets, that could probably get you through half of your day. And then what I'd recommend, so if you have 5 kits that are designed for a recare appointment, then why not have a couple of specialized kits on the side so that when you know you have that certain client coming in or that certain patient, then you can pull out these extra kits that will help you with your instrumentation. For instance, if you had a couple of kits that had Gracies in them, you could have the Gracies with a regular standard tip, or you could have the mini Gracies that have the longer shank. And then you could have perhaps one of these, which is a specialized kit that is strictly for furcations. We have the furcation, the neighbor's probe, then we have a couple of diamond furcation files, and then we have the furcator. So again, we have the 5 typical base setup, then we can have a couple of more specialized Gracies, and then one kit with the furcations, the furcation kit. And then we have the Ergo Access. Now these instruments are designed for those clients who can't open their mouths very wide, so mostly for the elderly, but also for kids. And if you have that client or that patient that has the lower anterior incisors that are tilted lingually, this will really help you access that area without having an instrument pressed up against their face. Another kit that you could add is the implant maintenance kit. Now they have 4 different types. This one here is the mini universal. And the material, it's an alloy, it's a titanium alloy, so it'll be gentle and safe for the implant abutments. Now the nice thing about these is that you just unscrew it and the tip can come out. Now this is for implant maintenance only, so none of the other ones the tips come out. It is for this one only. And so what's nice about it is that this one I have in my hand is a universal, so you can use it throughout. However, it does come in the Mini Gracie 1-2 for the anterior, and it comes in the Mini Gracie 13-14 for the distal of the posterior, and also for the Mini 11-12 for the posterior for the mesial.